You know, one thing I tell people, and you know, you've seen patients, you know how this works. It's uncomfortable for doctors when patients do this, but when I go see my physician, when he says, maybe we should get some blood tests, I feel okay about saying, and not because I'm a former physician, but because I'm a patient and I believe it's my right to say, well, why? Because as you and I both know, often when doctors are ordering tests, in my era of training, there was a, why don't we just order these tests? And you know, the tests will often be a long check sheet and you're just going down, check, 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 check. I think the question now should be why? How is it going to change my care? That requires a little bit of mind shift in terms of patients. You know, I like to say my mom goes to the doctor and she'll call me and say, I saw my doctor and I really liked her, but she didn't even order a blood test. And, you know, we want, as patients, we have to kind of say, maybe the answer is to wait. Maybe the answer isn't to jump in all the time. But when it's time to jump in, then I say to my physician, whose computer is now programmed to send my blood test order to the hospital lab, no, can you please send it to LabCorp or Quest, the two commercial labs I know are in my network, because LabCorp and Quest may charge $10 for the exact same lab test that a hospital would charge $500 or $1,000 for, and you and I both know that they're both putting tubes of blood into a machine which spits out numbers. So likewise, I think we can say to our physicians, okay, if I need an x-ray of my knee, which of the, you know, dozens of x-ray centers within a mile radius of this office will do a good x-ray at a reasonable price? Now, you and I both know that most doctors don't have that information now. But I think the more patients ask, the more they will have that information. And I think, sadly, you know, those of us who went into medicine didn't go into it to like be bean counters or, you know, to think about bills, but that's the position we're in now to advocate for patients. So I would say, you know, it's kind of the doctor's responsibility to know which x-ray centers are good value now, and to say to the one who's charging $1,000 for a $100 x-ray, I'm not going to refer patients anymore because I don't want you ripping off my patients. So a lot of work for patients, a lot of work for doctors, but I think not only will that save money in individual cases, but it will send a message to the centers that are overcharging that, hey, we're going to act like this is a market now and we care and price matters, and P.S. now we are paying for that. You know, with my $5,000 deductible plan, it matters to me.
So this is an important theme of your book, that you do put a lot of the burden of containing and costs of reducing prices, and also of deciding what you're going to get and where you're going to get it, on the consumer. I was struck by the recommendation you made that people actually review the papers that they are asked to sign, which of course they sign without looking at them,
right,
to make sure that they're not being referred to doctors and hospitals who are not going to be paid by their insurance company because they're out of network, as
right,
it is said. And I had the picture of a patient on a stretcher, you know, clutching his chest and having to go through that paperwork, or running down the list of drug prices at that hospital or the lab tests and saying, no, I don't want you to do these and these and these things because they're not covered, or
right.
You see the point I'm making. Is this
and I think
fair and realistic?
Right. It is a big, unfair burden to put on patients, but it's the situation that we find ourselves in. And of course, I don't think this is the ultimate solution. But, you know, the alternative right now is like someone in the book who's, you know, being rolled in on a stretcher for an emergency appendectomy, and the business manager comes to her while she's in a gown and says, we need your credit card before we can proceed with the surgery. And she's like, you know, I'm naked, I don't have my wallet. And the business manager says, well, do you have someone you know who we can call and get a credit card number so we can proceed? That's the alternative now. So it's not like, of course, in an emergency, you can't do these things, but there are lots of parts of our medical care that are not emergencies. So where possible, yes, it's unfair and yes, it's a burden. But I think if we don't take these steps, then the system won't respond. And the ultimate goal, of course, is not to have to go through those forms and write in, as I do, I will pay anything my insurance doesn't cover so long as it's in my insurance network. But the ultimate goal is to prod hospitals to respond to us and to say, okay, if you go to an in-network hospital, then it's our job to ensure that the ER doctors, the radiologists, the pathologists, the anesthesiologists are all in your network too, because that's extra work for them. You've run hospital systems, that's extra work, but the hospital knows which anesthesiologists are in my insurance network. I don't. So I think the goal of this prodding is not to say this is the final answer, but to say, to push all the providers who are not paying attention to this to do so. And it's unfortunate that this has fallen into the patient's lap and into, on the backs of sick people who should be thinking about how they're healing, and also onto into the laps of doctors who should just be thinking about what's the right thing to do. But, as we all know, physicians spend a lot of time dealing with this out-of-control system, feeling as helpless as patients, I have to fill out all this paperwork. I have to do pre-authorization for a drug that's 100 years old. Unless we start squawking, I think that's going to just get worse and worse.